How to get pain relief from sciatica. The sciatic nerve is the largest nerve in the body. It literally starts in the lower back and extends down through your buttocks, down into your legs, and into your feet. It normally extends down the posterior side of the body, where you can tend to sense it if you feel any kind of sciatic type of pain, and it can go down into your feet and toes. This nerve actually combines with several nerves that exit at the low back and combine into one nerve, so that's why it's the largest nerve. Sciatica is when you have compression somewhere along this nerve pathway. It can be either at the origin or from the spine itself. It can be compressed as it's exiting the spine or anywhere down the nerve pathway, like your buttocks or your hamstrings, or even down into your calves. It just depends where the compression could be. The knee joint could be another area that sometimes you can compress in that area, but sometimes they don't call that sciatica. It's normally radicular pain, meaning you can feel the pain radiating down the back of your leg into your calf or into your feet. You can feel numbness into your toes, or tightness or pain down into the hamstring area. And normally it's exacerbated as you kind of lift your legs straight. As you try to stretch your hamstrings, you would tend to feel more pain because it's trying to stretch that nerve, and it tends to cause more pain. Now, sciatica can be caused from many different conditions. Typically, it can be things like scoliosis. It could be spinal stenosis in the lumbar spine. Both these conditions involve the vertebra being moved out of position, affecting the diameters of not only where the spinal cord exits, but also where the nerves exit. Therefore, it can affect this nerve directly. It can impinge some of the nerves that create the sciatic nerve, and therefore it can cause the condition known as sciatica. Also, when the spine shifts out of alignment, it can start affecting the discs. And if discs bulge and they herniate, it can compress on these nerves, and that can lead to pain going down the sciatic nerve, which can also lead to something what we know as sciatica. Also, as these two conditions exist, scoliosis, stenosis, misalignment of the spine, now it can affect the disc in terms of its alignment, but it can also lead to disc degeneration. Now, disc degeneration means the disc itself is actually getting thinner. As the disc gets thinner and degenerated, the spacing for the nerves tends to decrease over time. And as it decreases, it's more prone to being compressed. And if it's more prone to being compressed, you're more likely to feel sciatic pain going down the sciatic nerve. Now, the question is, how painful is sciatic, and how painful is sciatica, and how debilitating can it be? Well, unfortunately, it has a very large spectrum. It really depends on the compression of the nerve, how much compression there is, but it also depends on what fibers are being compressed on each nerve. We know nerves, all the fibers don't sense pain. So somebody could have some compression on the nerve tissue and feel no pain. They may have some malfunctional issues, but very little pain. And somebody can have the exact same amount of compression and feel extreme pain down that nerve. Because when you're looking at a nerve, you're looking at a multitude of fibers. Some nerves feel pain. Some of those fibers feel pain, and some of those fibers don't. So therefore, the degree of involvement, or how much you feel, or severity, can be very different from person to person, even with the same amount of compression, but therefore it depends on each and every case. We know it's going to affect the lower part of the body. Normally it's unilateral. It affects only one leg and one side, and the range can be very mild to very severe, and it can be constant, and it can be intermittent. So it has a very wide range of how it affects somebody. The question comes is, if you have sciatica, how do you take care of it? How do you get better from it? How do you improve it? Well, normally you got to deal with the compression. If you don't deal with the nerve compression, you're normally going to have continuing residual problems, and it's going to lead to more and more issues. You have to either realign the spine into a better position to uncompress the nerve if it's coming from a spinal problem, or if it's coming from somewhere else, you have to find out where it's being compressed and remove it. Because if you don't remove the compression, which is what's causing it, all you're doing is numbing what you're feeling, and they can normally do that with injections or pain pills, but the problems are going to come back because they're not addressing what's truly causing it, which is the compression of the nerve tissue. Now, scoliosis, unfortunately, is a very common cause of sciatica, especially in older adults. As patients age and as their curve progresses because of the result of compression of gravity, this compression of gravity will lead to disc degeneration, disc herniation, spinal stenosis, and more misalignment. All the four things that we know that originate sciatica from the spine. Because of this continued progression, this will actually start affecting the sciatic nerve, which can lead to pressure going down into that leg or pain going down into that leg, affecting that leg problem. It can also start affecting the strength of the muscles in that area and also start to affect the strength of the muscles around the spine itself. So this lack of alignment creates all these issues. Now, normally these patients are treated like they have a low back problem or a low back injury. So normally they're treated like they're trying to increase core strength or given basic general exercises to help increase their core, or maybe they're given like a lumbar support, and they're treated like they're trying to help treat somebody who just has a sciatic problem. But if you truly have scoliosis and you have sciatica, you really want to reduce what's causing it by moving the spine back into a better position. And this is true almost for every case of sciatica that's originating as a result of the spine. The straighter and the more aligned your spine can be, the less likely there tend to be compression, and the less likely there's compression to the nerve tissue, the less likely you are to have sciatica. And if you're already experiencing it, if you reduce those problems, like we mentioned, you're more likely to resolve what's actually causing it. So sciatica can be very debilitating, and it can definitely worsen if it's left untreated, especially if it's a result of misalignments that will progress as a result of gravity pushing down over time. So therefore, to treat the cause of it, you really want to make your spine as healthy as possible to decompress the nerves. The sooner you start dealing with the issue, the more likely you are to get a positive outcome that doesn't require invasive types of treatments like injections, or even the most invasive like surgical decompression, which can be very invasive and can affect and cause limitations to people's lives as they age. So we like to be proactive. We like to reduce the problems as soon as we see them, and we like to reduce them by addressing the cause, which is allowing the spine or realigning the spine into its best possible position so you can be as healthy as possible. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.